Let me ask you something. When was the last time a doctor told you that your blood tests looked completely normal, and yet something still didn't feel right? Maybe you were tired all the time. Maybe you were putting on weight no matter how little you ate. Maybe your memory was a little foggier than it used to be, and the doctor looked at your results, shrugged, and said, "Everything looks fine. See you next year." Here's what I want you to understand today. Normal, on a standard blood test, is not the same as healthy. It never has been. The ranges doctors use were designed to detect disease that has already arrived, not disease that is quietly, invisibly building, year after year, in your blood vessels, your kidneys, your brain. Today, I'm going to take you through everything your annual checkup is missing, the silent signs your body is sending right now, the one cheap test that could give you a 20-year head start, and the surprising science that connects your heart, your kidneys, and your brain through one single root cause that almost no one is talking about. Stay with me to the end, because the last piece of this is the part that most people never hear. Let's start with blood sugar. Because almost everyone has had this tested, your doctor draws blood, checks your glucose, maybe your HbA1c. If glucose is under 99, you're normal. If HbA1c is under 5.7, you're normal. If triglycerides are below 150, you're normal. And every year this same test with the same result until one year the number crosses a line. And suddenly you have prediabetes or type 2 diabetes, and you think, but I was fine last year. Here's the truth. You weren't fine last year. You weren't fine 5 years ago. The glucose test was just measuring the wrong thing. To understand why, let me explain how this system actually works. Your body's job is to keep blood sugar in a very tight range. Too high, dangerous. Too low, dangerous. So when you eat and blood sugar rises, your pancreas releases insulin. This is called insulin resistance, and it is, by some estimates, affecting more than 40% of adults worldwide. Many of them have no idea, because when cells stop responding to insulin, the body doesn't give up. It just makes more insulin, more knocking, louder, and for a long time, sometimes years, sometimes decades, this works well enough to keep blood sugar looking completely normal. So your doctor sees normal glucose, normal HbA1c, tells you everything is fine, but while that's happening, insulin is quietly doing enormous damage. Because insulin doesn't just move glucose. At high levels, it acts as a growth and storage hormone. It promotes fat storage, especially around the abdomen. It causes sodium and water retention, raising blood pressure. It triggers low-grade chronic inflammation throughout the body, and it stimulates rapid cell division, which, as we'll discuss shortly, has serious implications for cancer risk. The tragedy is that we have a test that can catch all of this early. It costs around $25 to $35. You can order it yourself without a doctor. It's called the fasting insulin test. You fast overnight, get a blood draw in the morning, and the result tells you exactly where your insulin levels stand before your blood sugar shows any problem at all. 25. It tells the liver to convert excess sugar into fat. This fat accumulates in the liver, a condition called non-alcoholic fatty liver disease, or NAFLD. And here's the cruel irony. A fatty liver then becomes more insulin resistant itself, which drives insulin even higher, which drives more fat into the liver. It's a vicious cycle, and it can progress to liver fibrosis. Sign 3. Persistent fatigue and brain fog. When kidneys lose filtering efficiency, waste products accumulate in the blood, urea, creatinine, other metabolic byproducts your body needs to expel. This toxic buildup affects every cell in your body, but the brain and muscles feel it most. You feel like you're running on empty. You can't focus. You feel slow. You sleep 8 hours and still wake up exhausted. Most people blame stress, or age, or their busy schedule. Their kidneys are not on their radar. Sign 4. Swollen feet, ankles, and lower legs. Your kidneys control sodium and water balance. Damaged kidneys retain excess sodium, and water follows sodium. This fluid has to go somewhere. Gravity pulls it down. By evening, many people with early kidney disease notice their shoes feel tight, their socks leave deep marks, their ankles look thick. They call it water retention. They don't realize it's a kidney problem. Sign 5. Constantly feeling cold, pale skin, and breathlessness. Your kidneys produce a hormone called erythropoietin, EPO. Is the signal that tells your bone marrow to produce red blood cells. When kidneys are damaged, EPO production drops. Red blood cell production drops, and red blood cells carry oxygen. Less oxygen to your muscles, you feel weak. Less oxygen to your brain, you feel foggy. Less oxygen to your skin, you look pale. Less oxygen to your body overall. You feel cold even on warm days. And with any mild exertion, climbing stairs, walking briskly, you find yourself short of breath. This is kidney-related anemia, and it is widely misunderstood and undertreated. Sign 6. Metallic taste in the mouth and ammonia-like breath. When the kidneys can no longer filter waste efficiently, compounds called urea and other nitrogen waste products build up in the blood. Some of these eventually reach the saliva. Bacteria in the mouth break these down into ammonia. The result is a faint but persistent metallic taste, a feeling that food doesn't taste quite right, or breath that smells off, sometimes described as urine-like or chemical. If you've noticed this and written it off as a dental issue, it's worth getting your kidney function checked. Sign 7. Itchy skin with no rash. Advanced kidney disease causes phosphorus to accumulate in the blood. The body tries to offload it through the skin. This creates a deep, maddening itch, often all over the body, particularly at night, with no visible rash or skin condition to explain it. People try moisturizers, antihistamines, different laundry detergents. Nothing works, because the problem isn't on the skin, it's in the blood. Sign 8. Needing to urinate frequently at night. Healthy kidneys concentrate urine during sleep so you can get through the night without waking up. Damaged kidneys lose this ability. They produce dilute, high-volume urine around the clock. Waking up once or twice or 3 times per night to urinate is not simply aging. It is frequently a sign of declining kidney function. Sign 9. Blood pressure that's hard to control. Here's the cycle that destroys so many people's health silently. High blood pressure damages kidney blood vessels. Damaged kidneys retain sodium and water. Sodium and water retention raises blood pressure further. Round and round it goes, each revolution doing more damage to both organs. If you've been on blood pressure medication for years and your doctor keeps having to increase the dose, your kidneys may be driving that problem. Sign 10. Poor sleep and restless legs. Kidney disease disrupts the balance of electrolytes, calcium, phosphorus, and other minerals that regulate nerve and muscle function. This can cause restless leg syndrome, an irresistible urge to move the legs, especially at night, an uncomfortable crawling or tingling sensation, a feeling of tension or anxiety in the legs. It disrupts sleep profoundly, and it is one of the most commonly overlooked symptoms of declining kidney health. Even when the brain can no longer properly use glucose, it can still use ketones. Ketones are a completely different fuel. They're produced when the body burns fat for energy. When you fast, when you eat a low-carb diet, or when you consume specific types of fat. Research from Dr. Stephen Cunnane at the University of Sherbrooke in Canada has shown clearly that while glucose uptake in the aging brain declines, ketone uptake remains remarkably preserved. In other words, the delivery system is still intact. The brain can still accept and use this alternative fuel. We just need to provide it. This has led to a serious and growing body of clinical research exploring ketogenic diets, MCT oil supplementation, and other ketone-raising interventions as potential tools to slow cognitive decline.